Okay, we are live now.
Hello everyone, a very good evening to one and all, and warm greetings from the Optometry Council of India. To begin with, the Optometry Council of India, along with the American Academy of Optometry India chapter, presents to you a series of case presentations. Now, these case presentations will help you towards your journey in the fellowship application for the American Academy of Optometry, one of the most prestigious fellowships. In fact, India boasts of quite a good number of fellowship holders of the American Academy of Optometry. So we thought that this would be useful for all those of you who are aspiring to apply for the prestigious fellowship from AAO. So to begin with, we have the first of the case presentation series. We have with us Ms. Mansi, who will be presenting tips and tricks on case presentations. And to introduce Mansi to you all, and also to be moderating today's session, we have amongst us Mr. Fakhruddin Barodawala, so who is an optometrist and academician, and he will be taking over the session. So over to you, Fakhruddin, and welcome all of you once again.
Thank you, Dr. Anita, for that kind welcome. And I think this is going to be a fun series, learning series, where OCI, Optometry Council of India, and the American Academy of Optometry, the India chapter, has come together, as Dr. Anita was mentioning, to train and to guide you all in how to write case reports and everything. And it is my pleasure to kind of moderate this session and also introduce my fellow here, Manasi Mahalingam. Just to introduce Mansi to everyone, Mansi is an optometrist and graduated with bachelor's as well as master's degree from the Elite School of Optometry. Currently, she is taken up as a clinical optometrist role, and also she is an optometry faculty at the Arvind Eye Care System in Chennai. And she's a very recent fellow. She achieved her fellowship from the American Academy of Optometry just very recently in the year 2020. And her research areas and areas of interest are in posterior segment diseases and diagnosis. Specifically, she likes to do a lot in OCT and OCTA, low vision, and also image analysis. And Mansi took up this first session in the series of sessions we have planned up for you guys to train you on how to start writing case reports, not only for the fellowship perspective, but also for publication point of view. And she's going to share her tips and tricks with us today on how to write the case report. So I would also encourage everyone who is listening to the session via the Facebook Live to post in your questions if you may have, so that we will take some questions at the end of today's sharing. So welcome, Mansi. Let me just kind of allow you to share your screen and take us through your tips and tricks.
Yeah, is my screen visible?
Yes, and we can hear you well. Yeah,
thank you. Thank you, FP sir, for inviting me with your sweet words. And I also thank Dr. Jamil Riswana and Ms. Anita Aravind for giving me the opportunity to be the first one in this beautiful series in the collaboration of AAO India chapter and OCI as well. So to the audience, good evening and a very warm welcome for taking time at your weekend to attend this webinar titled Tips and Tricks in Writing a Case Report Towards Fellowship in American Academy of Optometry. First of all, I would like to start, why do you actually wanted an FAO? You may have bachelor's and master's. Why do you want that FAO? So even I thought this before starting to apply for FAO, but I came to know this FAO when my faculty members, many of our faculty members have this four prestigious four-letter word after their name, like after their degree, which made me push towards this four-letter word. It is not just a four-letter word, but it is somewhat a good distinction and good recognition of our optometry services for this field. And we'll also be included as one among the Academy's online directory of fellows. Like our name will be in the Academy's directory, which is a huge thing. And not only that, it is also a place to learn from others. Like by doing this, we can get to know about more fellows, like not only from India, like all over the world, and we can get to share our own experiences. And we can also join one or more sections or special interest groups devoted to various areas of focus. And we can also access to the local chapters and social function and study opportunities between regular annual meetings. So we can also get a chance to attend the regular annual meetings happening every year, conducted by the academy. So basically, to apply for FAO, there are 3 categories available under which you can enroll yourself. So the first is the clinical category, and then is the scientific, and then the special category. So clinical candidates are those like who are on the current regular practice, who can see the patients, who are seeing the patients in their regular practice. So those are clinical candidates, those people. And scientific candidates are those like whose main work is research, like who's doing their doctorate or doing their masters or doing work as a research optometrist. So they can enroll by submitting their research works or publications, their earlier publications or the publications in process. So those people will come under scientific candidates. And the special categories are those like who includes like who are optometrists but still now practicing as administrators or executive directors. So they can submit their own essays to complete this FAO. So, but the case report is mainly needed for those who are applying in the clinical candidate. So myself and many of the fellows who got the fellowship last year predominantly came under clinical candidateship. So in which the case reports will help us achieve 10 points in each of the 10 points each. So, but whereas it is not mandatory for the other scientific as well as special category candidates. So yeah, so I've just first briefly run through what a case report is, and then I'll explain my experiences while doing fellowship. So a case report is nothing but an article or a study that describes and interprets an individual case. It's like a presentation of a case, like we usually present a case in a class, right? But when it is in a written form, we'll call it as a case report. So any people who is interested in research will start their first step as a case report, which will, as I depicted in this picture, case report is the first step, which will like enable us to do more a proper research in the further, in the further days. So why case report? So we can report a case when it is actually unique, so a novelty case. And also we can report or publish a case which shows an important variation of a disease or condition. Like for example, we may see like we may have read so many typical features of a disease. For example, if a patient with retinitis pigmentosa have 3 triad of clinical findings. But if we see the patients with the same or any atypical features, we can write it as a case report. Or if you come across a case with unexpected events that may yield new information or any useful information, that can also be written as a case report. And also if a patient has any one or more unexpected diseases or disorders, can also be written as a case report. For example, a patient with these features can come under this syndrome. So those features, those cases can be written as a case report. So this is for general, not FAO. This is for general case reports. So usually we can structure a case report like a title, which starts with a basic title, and then we will have an abstract, introduction, case details, discussion, and conclusion. So I'll run through about each of these titles given here. So first is the title. So for every title, when it is attention grabbing and interesting, it would be better, like it would probe the readers to read rather than reading a simple title. For example, I have quoted here. So these case reports, which made me to read the case report itself. So I saw a case report named a vision saving straw in a retinopigmentosa patient. So which made me which probed me to read what is vision saving straw, that too in a case of retinitis pigmentosa. So titles like this can be more like it makes it makes the readers to read with the title itself. And then so this is a case report of Dr. Jamil Riswana. So the title was also interesting. Natural history of idiopathic absence nerve paralysis in a young adult. So these are the interesting like examples of an interesting title. And then we have is the abstract. So abstract is like a trailer of our case report. So it is just a brief and a summary of a case and the problem it addresses and message it conveys. So it should be preferably short, because not I mean, when the audience or the readers are interested to read the case report or any research, but they don't have time to read, they'll just read this abstract and get the crux of your paper. So it should be that short and crisp as well. And we should also provide minimum of 3 keywords. So keywords are nothing but it is like example of an hashtag. So it will pull away, or I mean, it will help the readers to get all the papers with the help of just keywords itself. So this is an example of an abstract, which is like a very short paragraph with all the details in it. And then comes the introduction. So introduction should be a brief overview. So it should provide relevant information about the clinical condition which we are going to discuss as the case report, and the signs and symptoms and management. And since we are introducing about the condition in the introduction, we should define all the abbreviations in the first use itself. So generally, the introduction should be about 1 to 2 paragraphs, and we should not bore the readers in the introduction itself. So it should be just a precise introduction about the clinical condition or the diagnostic. So my case report was on diagnostic investigations. So I wrote completely on the diagnostic procedure as well as the condition. So I'll show you my case report at the end. And the next title is a case detail. So first, now we have introduced the condition. Now we have to explain our case to the public. So which means first we'll describe the patient itself, like the demographic features, and then their history, and then their ocular examination results, and then what the results of pathological and other investigations. For example, a patient with uveitis may require many systemic investigations. So those investigations should be written in the case report. And what was the treatment plan planned for the patient, or how the patient was referred to another center, and what was the expected outcome of the treatment plan, and what was the actual outcome. So these are the case details which should be written in the case details of the case report. Yeah, so patient description can be written like the subheadings of describing the age and the epidemiology, like a 49-year-old female patient, and with the visual complaints, and if there is any specific complaints regarding to the case report, and along with that associated complaints. And we can also write, if necessary, we can also write general health history of any medications and previous surgeries, and patient's occupation if required. So these are the details should be given when you consider a case. So this is an example of a case report. So as we can see, they have started with the demographics of the patient, and then they briefly. So since this is retinoitis pigmentosa patient, they have just added only the relevant findings and not all the things. So we need not mention about the IOP for a retinitis pigmentosa patient because it is not mandatory. So we can skip those, and we can write only the main features, main characteristics of the patient required to discuss in the case report. So for this patient, the OCT was done, and then they have done the visual field also because it is an RP patient. So we should write only whatever is mandatory. Yeah, so we can also write, if required, the history of any previous class prescriptions and what was about the vision, and if required, objective and subjective refraction. And if case of any BV cases, we can write the extraocular movements and cover test. And we can also start like the anterior segment was normal, and about the apprenation tonometer, and then the posterior segment. And then moving on to investigations, as I said earlier, the results of investigations with report. If a patient has like any blood investigations done, we should not write the entire values in the case report, rather than the important like CSR and ESR rates. So those points and important points can be added, and how the patient was followed up. And then is the discussion. So now we have discussed a case. So now we should discuss, and like in discussion, we should focus why, which made you write the case as a case report. Why should you, which made you focus on the case, the uniqueness of the case. And we can also compare and contrast the existing literature on the topic. So what was unique in our case and what was dissimilar in our case and with the literature. And also we can very detailedly explain about the findings of the patients. So in discussion is the place where we can write where the authors can write their own points with relevant literature support. And at last, we can write how can this case report add evidence to the clinical practice. So this is how the discussion should be. And so this is an example of discussion. And then is the conclusion. So in conclusion, it is just like a summary points. You can also like just 2 or 3 lines. And you can also provide clinical recommendation. Like for example, OCT should be done for retinitis pigmentosa patient, like that. And then ending the case report with proper referencing and then a proper citation. So this is how a brief case report looks like, and it should be like. So now I'll discuss the case report which I submitted for my fellowship. Is my PDF visible?
No, we are still seeing your PowerPoint, Mansi.
Okay.
Yeah, you'll have to reshare it, I think.
Okay. You know?
Yeah, we can see your PDF.
Thank you, sir. So I was about to submit 2 case reports because I got other points in my previous papers and publications. I mean, papers and conference presentations. So this is my first case report. So which I was doing my master's post graduation while I was while I enrolled for this FAO. So I decided to take one of my patients, like whom I to consider for my master's study as well. So I wrote on my specialty, my area of interest is diagnostics, like OCT and OCTA. So I thought to write about the OCTA itself. So I have given a topic to this because polypoidal choroidal vasculopathy is mostly based on a surgical response. Like surgical treatment is the apt one. But we found a parameter like a biomarker where OCTA can be used to say whether it is subjective to treatment or not. So that's why I have kept this title, OCTA based response to the treatment. So as I said earlier, I have provided a brief abstract, like a paragraph, I mean, with 5 to 6 lines and the keywords. So these are the keywords which I mostly used throughout my case report. Yeah. So as I said earlier, introduction, it should be providing background to the condition, and it should be just 1 or 2 paragraphs. So since I wrote about PCV, I wrote what is PCV and what is the epidemiology of PCV, what are the clinical findings, signs, symptoms, and then I slowly moved to the gap in the literature, and then I started my case report. So case report, I have divided, since the patient had so many visits, I have classified them as various visits with the date itself. So which makes the reader more interesting to compare the dates as well as months. So for here, so in the baseline visit, it is always mandatory to provide all the details in the baseline visit. Even though it is normal, we should write the positive or negative history of the patient in the baseline visit. So yeah, see, I have written like 56-year-old man visited the clinic with a complaint. I have also, since he's he did not have any complaint of history of flashes of lotus, I have written it as a documentation. And then I have written about the vision with their objective and subjective refraction, and how the patient was referred to the posterior segment. And in FAO, it is mandatory to write the differential diagnosis, because at the review, I was asked to write the differential diagnosis for this, because we usually don't write differential diagnosis as a separate paragraph or line. So this was the new thing which I learned in FAO. So add additional diagnosis which you had in your mind before arriving at the final diagnosis. So the PCV and ARMD are almost similar with certain different features. So that differential diagnosis should be written. And since it is a diagnostic case report, the images are very mandatory and a good clarity picture with proper figure legends. So I have showed the ICGA images as it is PCV and choroid related. And yeah, so till this I was it is my visit 1, and in visit 2, and it is follow-up 1. So we did image analysis as well. So I have added the image analysis also. So I'll just slowly run through my case report and then discuss the tips and tricks. So again, I have, so in visit 2 and 3, like in the follow-up 1 and 2, you need not write all the details. But like you wrote in the baseline visit, it is just important to write only the features which are differing from visit to visit. Like the vision may change. Since we are making the patient for, go for a treatment, we should write what if there is any difference in the structural as well as functional thing. So if the patient has any improvement in the vision or structurally, how did the retina change? How did the patient react to the treatment? So we need not write all the thing as rather than which is important to the treatment. So in the same, so visit 3 also we have written the same. Yeah, so this is the last comparison of all the 3 visits. So we can see a complete resolution of the clinical condition, and I have quoted it as an arrow, white arrow. And this is OCTA image of the patient. Yeah, and at the end I have ended with the follow-up visit. So for a FAO fellowship, a good case, a case with good follow-ups is mandatory. And then we have discussed about the image analysis. And then the discussion. Yeah, so at the end I have written a small conclusion. So like a one line, SSOCTA can detect the choriocapillaries, which can be considered as a factor. So I've just given a one line like to summarize. And references should be in a proper APA citation or any other citation referred by the academy, required by the academy. So this is my case report. Now I'll share. Now I'll share the tips and tricks which I learned or which I felt someone could have told me before doing this fellowship itself. Yeah. So for usually we use for case report, to write a case report, we usually choose a case which is unique from our clinical practice. But for fellowship, we should choose a case which should be representative of the patients which we work with or on a regular basis. Like it should not be a patient with extremely difficult findings. No, it should be a case which should represent your practice. Like what are the patients you see, how you see. So those. And they should also reflect different aspects of your optometric practice and should be cases that are either entirely managed by yourself or co-managed to conclusion. For example, so this is retina. I can't myself as an optometrist, I can't come to a conclusion without the ophthalmologist opinion. So how did the optometrist refer this patient? Does the optometrist correctly identify the findings prior to the posterior segment and then referred it appropriately? Or I could have even given a low vision aid so that it makes like coming to a conclusion, or choosing a case where the optometrist can completely disclose, come to a conclusion like a contact lens and binocular vision. So those cases it would be easier to write a case report in fellowship. And then we should also choose a case with thoroughly documentation of history, case findings, appropriate treatment, and referral. Because the writing case report is not just like completing FAO. We will be asked questions during a Viva. So in Viva, we can't answer like any of those questions if you have not seen any patients. So you should have seen the patient and you should know what was done from A to Z so that you can answer the questions in the Viva also. So it's always better to choose your case, like the case which you saw and not someone else. Yeah. And also we should choose a case with proper clinical decision than choosing a unique case. So now my patient had a good follow-up visits, good treatment plan, and good resolution of the condition as well. So that's why I chose this case. And the assessment is based on how the case was managed, but not how unique it is. And if the patient is being referred, we should provide the reasons for referral. So why the patient was referred? I can write as the patient had some changes in the retina, so which made me refer to the vitreoretinal ophthalmologist. And also we should write all the follow-up visits which should be added in the case report. So these are the main tips which you should have in your mind before selecting a case. And we should kindly never miss like a thought-provoking title and a case with good follow-up decision. And initial visits should have all the details of the patient, including all the details like their BCVA or the UCVA or intraocular pressure, everything. And figures and tables can be added. Like figures can be predominantly added because it will not make the readers to be bored. And whether the appropriate referral was done, And proper referencing and citation can makes your paper better when compared to a case report with poor referencing and citation. So we usually don't consider this referencing and citation as a very important level, but it is mandatory for all the case reports or any research work you do, especially in fellowship. And kindly avoid plagiarism. Kindly don't copy paste like any of your works from like any of your other works and then put it on your case report. Just try to write in your own words. Even it may be wrong, but try to write in your own words so that it could be yours and not others. And never ever make grammar or spelling mistake. Now there are so many technologies which makes you proper with everything. We have Grammarly and all those stuff. So we can, before submitting, we should recheck it many times before sending it to the for a review. And the case with poor follow-up. So never take a case with poor follow-up. So a patient with minimum 2 follow-ups would be better, so that we can, it would be like a story, a complete story. So how did you start the patient and how did you handle throughout the patient and how the patient was referred or how the patient was treated and what was the conclusion. So like it gives a flow chart of the story, case report, which makes the readers to read. Also, it makes the reviewers to get interested in your work. And a case with improper documentation. So not only for fellowship, but for a case report, we should choose a case with properly documented findings. And yeah, so these are the references for my content in this presentation. And yeah, keep calm and it's time to apply for FAO for the next year. Never miss the deadlines. So it is not a very tough process to go through this because we have done. So when I can do it, so why not you can? Even before starting the fellowship, I thought it was very tedious process to go through, but it was very simple. But we should make sure we are submitting all our works before the deadline. And also it is important to address each and every reviews by the reviewer. So this was the message. I mean, this was the picture shared by the FA, American Academy of Optometry, when I completed my fellowship. And I completely owe this fellowship to Dr. Jamil Rizwana, as well as my academic supervisors, Dr. Aditya Verma and Dr. Parveen Sen ma'am, without whom I would have not completed this fellowship. And thank you, and open to questions.
Thank you so much, Mansi, for that wonderful presentation of yours. You took us very nicely through the various aspects of a perfect case report submission, like how Fakhruddin mentioned earlier on, that this is not just a requirement for the fellowship process, but once you get into the groove of correctly documenting any case, it becomes easier for you to, send your work for publication, for applying for other prestigious fellowships as well. So this is not just for the requirement of your journey towards the fellowship from the American Academy of Optometry, but also help you in your journey towards publications and documenting case reports. So that's very, very important. Record keeping here helps in a lot. If you've documented well, then your work becomes easier as you put things and, put it in a correct protocol or a format that is a requirement of any fellowship journey, I would say. So thank you for that wonderful presentation and the valuable tips and tricks that you shared with us. I hope this is an inspiration for all those who are going towards the journey in the fellowship process from the American Academy of Optometry. So I request Fakhruddin to take over, and at the moment, I don't see any questions. So Fakhruddin, if you can just take the lead in, sharing your experiences, like what inspired you to take up this fellowship, and maybe have a discussion with Mansi as to how you guys went ahead with the entire process. Was it really tough? Though Mansi sounded that it was a simple journey, but I am sure all of us have our set of apprehensions because it's a very prestigious thing and the requirements are pretty tough. They have, the guidelines are pretty strict. We are not used to the system, especially we are not in the habit of, recording cases also. So right now, if I were to, start recording cases that I'm seeing, what are the things that I need to pay attention towards? If you can just guide us, it would be great.
Right. So thank you, Mansi. I think you covered everything, which, as you mentioned, somebody should have told us this when we were kind of planning to do. We had this knowledge and information in bits and pieces, but it's very nice to see that you have put up all that together and shared with everyone here today, right? And those who are interested, the American Academy of India chapter is almost over a year old now, and Dr. Jamil Rizwana, who is the president of this India chapter, is very kind to support in any ways, and we are all there for you. There has been a Facebook Live by the American Academy of Optometry India chapter last year, where we discussed with the new fellows on how the fellowship process is. That video is available on the Facebook page of the India chapter, AAO India chapter, and I would encourage those who are watching us to go there, watch what we have discussed, and come up with questions and anything you may have. Reach out to us, and we are very happy and supportive for you towards your fellowship. So please, kind of go there. And I do have some questions, but before I take up some questions, as Dr. Anita mentioned, that we are not used to this particular method of recording and all that, but I think now we have to get used to, because of the profession getting it into the betterment. And as Mansi also pointed out, the case does not have to be a unique case which you see 1 in 100 patients. It should not be a unique one. It should be a case which you do it, or you do it day in and day out. So any simple contact lens patients which you have followed up, any soft lens, multifocal RGP lens contact lens patient, on any particular simple disease ARMD patient where you might have done a low vision workup and followed up the patients and see the progress. That is very important. Don't think that I have to get a unique case of Leber's optic neuropathy, which you see 1 in 20,000 to be submitted. So don't be into that dilemma. You have to submit a case where you see in, day out, and that makes your life much easier. That's why Mansi sounded a bit, it's a piece of cake, right? So you have to submit something which you're more familiar, right? Awesome. So I have some questions, and yes, the first very important question, Mansi, is, do we have some examples of the case reports where we can refer to as the guide?
Yeah, actually, the website of AO, like, it is completely self-explanatory. I'll just share my screen. Yeah. Is my screen visible? Like the page
Yes.
of AO. So
Yes.
when you log, when you open the page of like aopt.org, there is an option for membership where you can just click the candidates and fellows. So where you can see the sample case reports available. There are 6 sample case reports where you can just click and open. You can get the PDF of the version itself. So this is an example of one case report. So these are the case reports which we even use to refer. So it is already available in the page itself, in the website itself. So there are 6 case reports available as samples. Yeah.
Yeah, so they become a very handy tool,
Yeah.
right? We can actually look at how people have written their cases and kind of put our case into their format, look at the style of what need to be presented, what not. Of course, the clinical knowledge is what we have, but how to put it in a proper format is also very important.
Yeah.
So there are 6 cases, as Mansi was mentioning, and all are kind of different from each other. So you can pick and choose which one suits you the best, and look at their format and go about, drafting your case, right?
Exactly.
Yeah. Mansi, the other question probably which we can, discuss on the review process. So yes, I have the case, I have written up the case. Could you share on the review process a little bit, and how does it go about the review?
Yeah, maybe I can share the review which I got. So there were 2 reviews given to me, and I'll show the one with good reviews.
So the whole idea is, while Mansi is sharing the screen, the whole idea is, once you draft your case and you need to submit it to the Academy website, and it goes through your subcommittee chair, and that particular subcommittee chair actually refers your case or sends your case to 2 independent reviewers, which then look through your case and give you valuable feedback. And that's where I think Mansi was mentioning that it's not just the fellowship, it's a learning process. So with the reviewers' comment, your case becomes much more tidier, much more nicer. So you can actually send it for publication later on as well. So yeah, Mansi, go ahead.
So, sir, is my Word document visible?
Yes, we can see.
Yeah. So this was actually I shouldn't supposed to share this, but just for the learning, this is how my case report was graded. Whether the case was complex or whether the optometrist can handle the. So there are some points which they will point you accordingly. So this is completely. So each review can vary from one case report to another. So I was kind of asked whether the patient was referred correctly to the retina and all those things, and about the treatment and discussion. So out of 100 I got about 70 points, and they have my first case report was accepted without revision, so which was a huge moment for me, because I was very happy when I felt like even my case report was recognized by the academy itself. So this is how the scoring sheet would be, and it can change from person to person, like depending on the case report which you write. Yeah. So the review process will not be that, that serious. They'll ask you the relevant relevant clinical findings. So even our Viva was not that tough. So they just asked, they were very friendly, and they were just asking clinical questions. So why did you refer the patient? Why did you do OCT for this patient? And what made you think like as a clinician? So it was very easy for, even though we were, we were shivering, but it was, as FP says, it was just a learning experience, and it was very good to get reviews from the people from the senior most in that field. Yeah. So even the review process, and they will give you some time to get back to them. So it will be like, I think they will give us enough time to do the review. So it will be similar to a publication process. So at the same time, you can learn how a publication process works like. But the thing is, at the end, you get, instead of manuscript, you get the fellowship done. That's it.
Yeah, very rightly said.
I have a question for both Fakhruddin as well as Mansi. In fact, Dr. Rizwana has also joined us. Dr. Rizwana is the president of the American Academy of Optometry India chapter. Thanks, Rizwana, for joining us this evening. So my question is, taking an inspiration from Mansi and Fakhruddin, if I were to apply for the fellowship for the next year, obviously this year we have crossed the deadline. How sooner should I start involving myself in the process? Should I do it right away? Because I'm not too sure if it goes to the reviewer process, how long is the process, whether I will be in time for the next academic session or whatever. I mean, how does it work?
Right. Yeah. So Mansi is sharing something, and then I'll add on. Yeah.
Yeah. Yes, you can.
Yeah. So your question is, when should I start? I think I should say you should start right away, because you need time to write your case, and it's always good to start at this point in time. The earliest deadline is the February 1st deadline. If you kind of want to sit for your fellowship examination or Viva for that particular year, your first case, if you are into a clinical candidatorship, must be submitted before the 1st February. Don't matter about the review, but your case must be submitted before 1st of February if you plan to sit for your fellowship Viva examination for that year.
So as a clinical candidate, the requirement would be that I submit all the 3 case reports at the same time, is it?
No, you start with one. You only have to submit your first case, get that review, and then you can, actually the first case will be very good in terms of getting you started to have that guideline. Once your first case is approved, the second and the following cases, if probably are going for more cases for your points, it's much more easy because you know how the review process is, what is expected and all of that. So it's only the first case, and it's only that first punch which you need has to be started as soon as possible.
Thanks.
And I think, ma'am, you may have many publications or posters or papers like which you discussed in many national and international conferences, which by which you can also get some points. Like for using posters and papers, we can get 10 points each. So ideally, a candidate a candidate can submit 2 or 3 case reports or even 1, but providing that they have all these with their hand in prior. If not, there is an option to submit even 5 case reports to get 550 points. But since like you are already done your doctorate, like you can get those points easily, like with your manuscripts or publications. I think you can get from degree also. There is a
So I'm gonna now pull from what Manasi just said, because it's very specific to Dr. Anita Aravind. Dr. Anita, because you've done your PhD, all you need to do is right away start the application process, open the portal, start the application process, and plug all the documents that you have. So your PhD thesis, your master's work, your publications, everything, and sometimes if everything, if all of it fulfills the 50 points, they will immediately say like you're done. You just have to appear for the Viva next year. And in case, if at all, I am only thinking that for a person who's done a master's and a PhD with at least 2 publications, they will need a minimum of 1 case report if you are applying in the clinical category. And in that case, it should be reaching the committee by Feb 1st. The first version of that document should reach the subcommittee chair by the 1st of Feb. But as both FB and Manasi was pointing it out, the best time is always now. You just open the application portal, enter all your details, put whatever you have, your CV, your resume, your certificates, your thesis and everything. And once you plug that in, then they will definitely tell you that what exactly is required from your end by the 1st of February. That's it.
Thanks a lot, all. So
Awesome.
I have
Great.
another question on from the FB Live audience. So they want to know, do we need to mention the epidemiology of the condition, and do we also need to share the consent to present the case?
Yeah, so it's more of how to write the case. So Mansi, do you think it's a part of case write-up? Yeah, so Mansi, you need to unmute yourself if you're trying to speak. Yeah. And
so, I don't think consent is, I mean, it is not like it is mandatory, but it is not.
Okay, I will probably take it, Manasi.
Yes,
Yeah, because when it comes to the US, all these HIPAA regulations and the ethics part of it is super strict. And so any case report for that matter, because even if it is images where the patient identity is not revealed, or if you say Mr. X, Mr. Y, so and so years old, male, female, there always has to be a line saying a written informed consent was obtained from the patient to actually share the clinical details through this particular case report. That has to be part of the case report, which is mandatory, and they will look for it. And with all the rigorous changes in the publication industry as well, this whole informed consent is really gaining a lot of significance. And so anybody that's wanting to publish a case report or who have interesting case reports, please, there are standard consent forms that you take consent from your patient saying that your identity will not be revealed, your confidentiality will be maintained. Nonetheless, your clinical data and findings will be shared for the benefit of scientific progress and understanding. I mean, there are standard consent forms that are available, and we can share it with you. That's point number 1. Point number 2, if you are publishing reports with respect to strabismus and PEDS and stuff like that, where you are even hiding the identity by just putting up a cover on the patient's nose and showing the gaze photos and stuff like that, 100% the consent is important. So anything to do with a human being, basically, where you are sharing the clinical findings, that has to be part of the process, and it is part of all the HIPAA regulations that the medical industry would look for.
Right. Thank you for chipping in, Dr. Rizwana. And whatever the images reports, you have to always hide the details of the patient identity. It's very important in that sense as well.
So also I have another question. How latest should the cases be? I mean, if I have a case which is 10 years ago, a case seen by me, can I present that? So how old can the cases be, or how latest the cases need to be?
Mansi, I'll start and you can add on, and Dr. Rizwana can also correct if there's anything. I think they are looking out for how well do you know the case. So if you have a 5-year-old case, and if you have a good follow-up of those 5 years, you can of course show in and how you have managed the case well. I am not too sure that there is any particular case which they mention about the timeline per se, but it's more that how well you know the case and you have to write up that case properly. Yeah. Awesome. I'm just
again to add up to what FB said, I think I'm sorry I joined late. Any case, more than one measurement follow-up is really important. So I think Manasi would have definitely mentioned that. So I think that is something I really would emphasize to all the audience out here, saying that you guys need to be following up, especially nowadays with the COVID. There is a lots of loss to follow up, which many candidates reach out to me saying, I have only one measurement of the spasm, but I do not have a second follow-up, after cycloplegia, or I have one image, but I do not have the post-treatment OCT image. I think you need to get that right, because the pre-post or that follow-up is really crucial, both from a publication perspective and from the fellowship perspective. Yeah.
Thanks all.
Yeah, I think I'm just seeing the Facebook here as well. I think we have taken up most of the questions, and before I hand over to Dr. Anita, visit the AO India chapter Facebook page. You will get a lot of information. This is just the start. We have just discussed case presentation, but it's not just the clinical category you can go in. You also have a research category, and you also have a special category with which you can apply for your fellowship. So there is a Facebook Live which is already available, and I'm sure that the future sessions will also cover those in depth, in detail, so that you are aware of all the criterias and guidelines. And do visit the AAO website, which also is very friendly. Everything is self-explanatory, and you will get all the information there as well. And without hesitation, please feel free to reach out to us, and we'll also be there to guide you along your process of your fellowships. We already have, I think, more than 20 fellows from India, if I get my numbers right. And I think more than 15 are in the process of getting the fellowship. And those are just numbers. We are looking at more people to join, I would say, our gang of AAO India chapter. Over to you, Anita, ma'am.
Yeah, before I conclude the session, I would like to hear from Dr. Rizwana, words of encouragement from her.
I mean, of course, this is the start, and I'm so thankful to OCI, first of all, for collaborating with the AO India chapter, because now we have a series of such presentations lined up, and so everybody can join every month to understand how we need specialty. We can publish these reports in core optometry and vision science specialties. Plus, as MD said, we will also cover the research and the specialty category, because we have fellows under all the categories. So we will cover that as well, as how you can definitely, get those categories or accomplish in those categories. But one thing, if I have to say today, everybody can become a fellow, whether you are just a fresher or you are 10 to 15 years into practice and 20 years into practice or out of practice, you can become a fellow, because there is always an opportunity. And I think definitely AO India chapter and OCI will ensure that we will guide you through this journey.
Thank you so much, Dr. Rizwana. On behalf of Optometry Council of India, I take this opportunity to thank firstly Dr. Rizwana, who is the president of the American Academy of Optometry India chapter, for being so welcoming and encouraging us to take this further and to offer this series of case presentations. We will be coming up with more and more of case presentations, so everybody gets to know at the end of this series that they're confident in writing up a case report, and even confident towards publishing those cases as well. And exciting times ahead, I would say, for the optometrists from India, because the whole lot of opportunities are opening up. We have, like Fakhruddin mentioned, around 20 fellows from the American Academy of Optometry who will be mentoring the future fellows. And believe me, they are so encouraging, so inspiring. and forever they have a smile. All the fellows whom I know always have a smile and make it sound that it's a very simple process. So wish all of you who have joined us today the very best in your fellowship journey. Even if you're not aspiring to become a fellow of the American Academy of Optometry, the takeaways from each of these case presentations should help you in writing up good case reports and help you towards publishing them as well. So thank you once again, Dr. Rizwana and the team from the AAO India chapter for all your support. Thank you once again, the audience, for joining us today. And the date and the time for the next case presentation will be published on our OCI Facebook page. So keep a watch out on that. Thank you so much, all of you.
And Anita, I would like to thank both Fakhruddin and Manasi for Manasi for initiating this whole and for serving as a volunteer for the chapter. Being like one of the youngest in the chapter, she's always, I mean, this is like a very admirable quality.
Thank you, ma'am.
And Fakhruddin would like, all the time say, okay, Dr. Riz, you're not there. I will jump in. Sitting in Malaysia in different time zone because I couldn't, when I said I need a volunteer, FB jumped in. And so thanks to these, both of these guys.
He's a great techie as well, ma'am.
He is. And I just wanted to tell all of you guys that whoever wants to join this journey, we will mentor you throughout the process. We will do a lot of mock-ups, especially now that we've learned, as Manasi was showing, in fact, how the review would look like. We've started doing a lot of mock vivas and, mentoring, one-to-one hand-holding and things like that. So please join in and let's just show the power of Indian optometry by having more and more people joining on board through this process and earning the distinction of an A-favor.
That's so encouraging. Thank you so much, guys.
Thank you. Thank you, ma'am.
Bye.
Bye.